pregnancy bleeding and period. Both conditions deal with bleeding via vagina in females in the reproductive age. One is physiologically normal, whereas the other one is in a physiologically altered state. Both conditions can pose problems and may require interventions. Pregnancy bleeding is always pathological, whereas a period is physiological. Pregnancy bleeding can cause displacement of blood in larger quantities, but in periods it is relatively less. The bleeding in pregnancy can be overt or occult, and the occult blood is altered. Pregnancy bleeding may or may not be associated with other symptoms like abdominal cramps, which may occur in periods as well, but the late pregnancy bleeding are associated with cardiovascular compromise, as they tend to be heavy bleeding. Where periods do not require any assessment, pregnancy bleeds require proper and urgent assessment and management. While periods do not affect the future pregnancies in an adverse way, pregnancy bleedings can, and they may require future follow-up management, as in the case of molar pregnancies. As there are variant conditions under the heading of pregnancy bleeding, they need to be understood separately and compared with periods. The importance of these two conditions, and understanding as how to differentiate, is based on the physiology and the pathology of the individual conditions. Basically, periods are physiological and pregnancy bleeds are pathological, occurring in a person with altered physiology.